तो घ्यायला डोळ्याने बघितलं तर सगळं दिसेल आणि हा प्रश्न येणार नाही की एवढी, म्हणजे हा प्रश्न यायला पाहिजे म्हणून एवढं उत्तर देता आलं. So what I explained them that we have been limited with today's current scenario of the patients, and that is why this question comes whether that much 40 ml of Anuvasan and 240 of ml Anuvasan, whether it is recommended or not. So it is decided by the patients. It's the requirement of the patient, and if we have such a variety of patients, then we can use them. It is asked to a Vaidya to have this freedom to decide the matra.
Thank you. Thank you, sir. Yeah. Yeah.
Anuvasanam. Not only while doing this Anuvasanam and Kashayavasti also. Am I audible? What we do is, as sir mentioned, it is based on the necessity of the situation, many other things. But the thing is, you see, किंचित् कालं स्थितो यश्च सपुरीशं निवर्तते सानुलोमानलः अनिलः तत्सिद्धम् अनुवासनं. So if it is not happening, then you are supposed to give one more Thailavasti until that is happening. So what happens is, sometimes you may require to do 3 or 4 Thailam or Thailavasti to achieve this. And recent times or current times, I think the affordability is a big issue. You are using, say, okay, 250 ml of the Thailam, and it was not retained maybe in 2 minutes, so the patient goes to the toilet. Then that is not a Siddha Anuvasana. You are supposed to do another 250. So affordability is also a big issue. So I think we will have to strategize things, how to minimize the quantity of the medicine and to get the maximum. Similarly, Kashayavasti. When we use Kashayavasti, of course, there is a lot of mystery about the Kashayavasti and everything. When this is going to murder me, like that, because. So what I do is, generally, of course, there are this need not be the most scientific way of doing it, but we do is just do a warm water enema in the beginning, maybe 300 ml or something like that. Especially if the patient is not having his normal bowel movement in the morning, then just do one simple warm water enema of 300 ml or something like that. Then he is getting a normal bowel movement. Then you do the Kashayavasti proper. Then with that single Kashayavasti, you will get the maximum benefit. The material, otherwise you will prepare all these things, you just introduce right after withdrawal of the Vasti Netram, all the quantity will be drained out. Then we will have to do the next. Yeah, so I think while doing these practices, we will have to be very practical also, because even otherwise Ayurvedic treatment is going to be very expensive these days.
Maybe there is influence, no influence of this modern medicine or modern parameters. That in every paper there has to be some parameter written, in front of it. So the question arises like, okay, it should be 80 ml or 60 ml or 100 ml. Okay, so I think that needs to be broken. That principle. It's not like that it has to be only 40 ml or it has to be 80 ml. No, it can vary. It depends upon Sneha Siddhi Lakshana. Maybe 3 days, 5 days, 7 days. So may require 40 ml, sometimes it may require 160 ml, depending upon that constitution, that prakriti. So those parameters, with which a patient comes to you, those should not be the standard, or they keep you asking, no? Like, डॉक्टर किती ml दिला तर ओके आहे, काल एवढं दिलं होतं पण तो लगेच पडून गेला, मग त्याचा उपयोग नाही झाला का? So like yesterday I had basti and after 10 minutes after having basti, I couldn't hold it. Okay, there was no retention. So that kind of questions come from them. So I think quantity depends upon the Sneha Siddhi Lakshanas.
Very well answered by everyone, because it was already explained in the panel, but still, as it was a question, I had to take it. Now, again coming to Mahesh sir.
Again coming to Mahesh sir, as Gadgil sir has made the ball roll on, and I would like to continue with this thing. Like, is Shamana Sneha, like whatever Sneha has explained in the text, are they recommended for Shodhana? Or we have to go plainly with Acha Sneha as Shodhana Sneha? What could be your experiences?
If you feel that okay, you have this 12 hours or 24 hours, or let's say 3 yama or 4 yama, 4 yamas, okay, you have this jarana time. Usually, what I do is using sometime madhyama matra, but utilizing the Shodhana principle. Like I keep observing the patient every day in Vardhamana matra, okay, maybe for let's say 4 yama, let's say 6 yamas, how much time that person takes, okay, for the Jirnakala, okay, for Agnidipana, okay, and accordingly I decide, okay, now this is the day, okay, now this is Adhastata Darshana, you can see, Varchas, you can see Snigdham, you have your mother is Pakva, it's not Apakva, then you go ahead for Shodhana. So maybe matra, you may find classical matra as a Madhyama matra, but it will serve the purpose of Shodhana. Practically.
Sir.
If you want to add something.
Yeah, sure.
Definitely you can use the Shamana Snehas advised for Shodhananga Sneha. Kushtinam Snehapanena Purvam Sarvam Upasade. That is Shodhananga Snehapanena. The first yoga itself is Tikta. So it is envisaged that this can be used. But I have a couple of points to remind. Number one, even in that consequence, after Tiktakam we see Mahatiktakam, isn't it? But my humble opinion is that anything which is with the prefix of Maha should not be used as a Shodhananga Sneha. You were mentioning that the Mahatiktakam, I remember. Because that Maha, anything which that prefix of Maha is having Rasayana property. So they are supposed to be used after Snehapana. Take the example that Snehair Apyaye Chainam Kushtakhnairam Dharandara Mukta Rekta Viriktasya Rikta Koshtasya Kushtinaha Prabhanjanastadhahyasya Nasyadeha Prabhanjana. So you are supposed to nourish the body with the Kushtakhna Khridas in between. So you may use this Maha Khridams for that. So all something which is with Maha, they are for relieving the Dhaduk Shobha after the treatment and also for repairing. So that is a request or an opinion. So whether it is Kalyanagam, Mahakalyanagam, Tiktakam, Mahatiktakam, wherever it is, use that Maha Yogas for this. And another point which Kalaji was mentioning is that, okay, see whether that clear Sneha is sufficient or Siddha Sneha is required. With both these Snehas you can achieve Utklesana. But there is a huge difference. Clear Sneha, Asiddha Sneha will induce Utklesana in a non-specific manner. But when you have a targeted Samprapti where you are supposed to work upon, Siddha Sneha is going to be the best. When you are using Asiddha simple Sneha for Kushta, it will induce Utklesha all over. But when Tiktaka Khrida, it will focus on Kushta Samprapti. So it will focus more on the Utkleshana of the doshas engaged in the Samprapti. So minimizing the unwanted Dhaduk Shobha. So that is the advantage of using Siddha Sneha.
Thank you, sir. We would just go on with Mahesh sir, asking him whether Snehapana of Ghrita and Snehapana of Taila and using Yamak as Snehapana. Have you had any experiences of selecting such patients and your experiences on the same?
Whenever you find many patients, okay, with they have this nausea or this this bone nausea with Grita, in those conditions or even Tamak Shwasa conditions, okay, I have used Tailapana along with maybe sometime Vicharana Sneha also I have used. Okay. The purpose is again Utkleshan, the purpose was for Shodhana. But Taylor Pan has been, I mean, it's in my practice since last many years. Initially it was not there, but since you find many patients who are not tolerable for gurtas and who need Sneha as a Taylor, then you can use it. Yes, for sure.
So any more expertise to comment? Yeah, Sukumar. Yeah. So when we have to go with Sneha Apana of Taila, especially it is told that it to be taken at night times, and then how to manage with the Kshudbodh and how to understand about it, because Gritapana, taking it in the day and understanding the Kshudha is quite easier. So any experiences of the panelist on this? It's an open question. Anyone can.
Using Sneha at night is advisable in some conditions, specifically when Pitta is a dominated thing first, and or the Rutu is also very dominated, like Grishma. In such conditions, using Grutapan in the latter evening, but little lesser doses is recommended. I use that. Also, in extreme cold climates, using Taila in daytimes, it can be also done. If a condition comes where Shodhan is to be done in Shishira Rutu, in such conditions, Taila is really a very good Snehapan. And similarly, like in a Vardhaman Matra, like for the combination, Sukumara itself is a combination of Taila Gruta, can be used. If extreme Roksha is there in Koshtha, in such conditions, Yamak helps to manage the palatability also and go for good Utklesh also.
Thank you, sir. We are just running in short of time, but I can't conclude this panel without asking questions on Vyapad. So I would firstly ask Prasad sir to explain us to how to identify that it has been a Sneha Vyapad. And first of all, it happens many times that patient have Jwara, Klama, Angamarda, Avasada, or they have Sneha Virechan only. And then we have to have a gap of an interval of a day, and again then re-establish about that. So please guide students and Vaidyas for the same.
Yes, Sneha Vyapat is possible, no doubt, for many reasons. The most important is, as I mentioned earlier, that Jnapaka, Rogi should be Jnapaka, and the Vaidya also should be very studious and should have sharp observation skills. So when these criteria does not match, definitely there are chances of Sneha Vyapa. And I have not, luckily, not met with any serious consequences of Sneha Vyapa, but definitely loss of appetite, maybe on after 2-3 days. Then some malpractices by the patients, like even if we give all these instructions, they may keep one packet of biscuit hiding inside the room or something like they may eat, especially when young patients are treated. Then definitely that will create some Adhisara type of issues the next day. Sometimes they may vomit. Fever I have not seen, but this Agnimandya, Adhisara type of things I have seen very frequently. I think we have to be more cautious. Actually, that is this Jitendriya is a must. I think I have not seen much serious consequences.
So similar question with any Sneha Vyapad of Matra Basti, and Srirang sir would explain this.
Matra Basti is a safe game.
Sure.
Most of the times. There is only one patient I can tell, a very chronic Malavar lady of some 65-70-year-old, and I had some Niruha first. After Niruha, then Anuvasan, and then she settled with good Malapravriti. Then I started with having little Sneha type of treatment, use of Anuvasan. After 4 weeks, when everything was improving, after 4 weeks she started having Pravahika-like symptoms. She was doing very good with her diet and routine, everything. She was Bishak Vaishya. But what I missed in this patient was after 3 Anuvasan, stage of Niruhana was there. But I continued with less dose of daily Anuvasan. That was the mistake in that patient. So after giving 1 Anuvasan, that condition resolved and everything again routinized. So that is the one case. If you permit, I will like to add one about the Snehapan Vyapad. Snehapan, the last day of Snehapan, the next day the woman was planned. Sarva Shariragata Kushtha, psoriasis was the modern diagnosis. After consuming 150 ml of Grita, the sweeper in the room, she told that patient that please get up from the room, I had to clean that room. So along with Dosha Utklesha, Mano Dosha Utklesha was also there. She got very angry with that lady. She said, I will not leave this room. And she turned to the wall and faced wall for 4 hours with that krodha going on in her mind. In the evening when she was asked for Snehan Svedan, when she just tried to get up from the bed, she got Sarvanga Stambha. Sarvanga Stambha, all, even breathing was very less. When I was called in that hospital and I went there and I saw that condition, all this background was unknown to me. Because nobody grasped that was the reaction, and because sweeper was, she was angry, yes, that's it. But nobody was aware of that. I went for Suvarna Sudshekar Pradhaman Nasya. And with that Pradhaman, immediately she grasped and started with normal breathing, and I just give some ashvasan, putting hand on her head. What happened? Why? What happened? What happened? She started crying. And after crying for some 15-20 minutes, she explained that I was very angry and I know this anger has troubled me a lot and all. Second day the woman was good. Everything went well. But that was a very typical Vyapad.
Thank you, sir. So I am going to end the session at the end by getting some tips to how to keep our Sneha balanced from Prasad sir about the Swastha Vrutta pattern. So that would be the last part. Before that, we have many questions also. Next to Prasad sir. Sir, you have been practicing Snehapan. Would you just highlight upon there be something different thought to be given for Balarog, especially with Snehapana, or how to look towards it?
Actually, I think Vaidya Mahesh Patil mentioned in his one of the first few slides that how important the Sneha is. And I'm working more on the role and the potential of Shamana Sneha these days. So Shamana Sneha is so wonderful. The potential is unbelievable. See, in kids, I'm using plenty of Sneha, and most probably in Shamana Matra. So those who are, those who can comply well with the program, what I do is doing 3 days of Takrabanam. Medicated means just little bit of ginger, curry leaves, haridra, that sort of things. Make maybe 100, 200 or 500 up to 750 milliliters of takram a day. Not for kids, for adults. In kids, the dose reduces. Give this for 3 days along with some peya or something like that. And then on the 4th day onwards, in the morning I give a small quantity of Shadharana Churnam in warm water just before the breakfast. Evening, the dinner will be given early. They say latest by 6:30. And after 3 hours, I fix a matra of Sneha and give it. Sometimes 25 ml, 30 ml. It may go up to 100 ml. So it is very easy. It is purely when the Chudvataha, and I even continue it for a month. And it is very easy. It is very patient friendly. and it works wonders. You see, there are certain important clues in our Sharirasthana, especially Sushruta. That means the origin of different vital organs. One example I can give you is that of Vrika, that Shonida Meda Prasada Vrika. The interesting thing is that even in chronic renal failure, even I have a report which I got yesterday in my clinic. I give Shamana Snehabana even to see 10.2, 10.4 creatinine. I restrict the other food and give Shamana Snehabana for maybe months together. 3 days Rukshanam, then 1 month Snehapanam, then again 3 days Rukshanam, 1 month. They may continue in long chains of Snehapanam, but it comes to 4, 3. So this interesting thing is that if we can associate this with maybe some allopathic help, like Shonida Vrika Prasada, Shonida Meda Prasada Vrika, sometimes the patient may require one erythropoietin injection once in 2 weeks or something like that. That the nephrologist will manage. So we give the Shuddha Sneham, and they give some primordial element for the Shonida Dhatu. The patient comfortably moves on without any dialysis or any other issue. So this is possible. Shamana Snehavan, so similar way, so in that case we will be selecting sometimes Vastyavayantaka Krita. In some other cases I have skin diseases which are not responding at all. So in that case we give sometimes Mahapittagam for Shamana Sneha. In diabetic cases we give Dhannandara Kritam. Similarly, Shamana Snehapanam, Kalyanagam in kids, especially this special needed kids, autistic kids, we give Shamana Snehapanam with Kalyanaga Kritam or Mahakalyanaga Kritam. So that has got tremendous potential. Unbelievable. That is what my experience. Proper Rukshanam, Srodha Shodhanam, then Agni Vivanam and give the Sneha. But the dietary part is very important. You will have to withdraw all other Snehas other than this medicated Sneha what we give. So compliance is a big issue, but those who comply is giving excellent results.
Thank you, sir. It's for the newcomers who are not familiar with Prasad sir that he has he has a center for autism. He has a 15-bedded IPD over there, and it's a very genuine place to be visited. So who are going to have a visit to Kerala, always make a point that you see this place. It's like a tirtha. So many of the students. So sure. So, yeah. Thank you. So extending the questions, we have more questions also that we have come across. I would just ask Mahesh sir that he has also good experiences of treating patients in sports medicine. So how do we look towards sports medicine? Do we give some, along with Abhyanga, does Snehapan or Snehabasti play major role in certain sports? And have you had any experiences of the same? Sure.
I mean, when it comes to sports injury, or rather preventing sports injury, Snehapana or all types of Vicharana Sneha are useful. Because usually you have patients of overuse injury, you know, like more than expectations, they are trained. There is a specific system, how to train athlete. But when it is not followed, okay, you may see, in this Indian cricket team, if anybody has simple sprain, okay, he'll out of action for 2 months, 3 months. But in domestic circuits, you will find you have athletes, okay, due to compulsion or their own expectations or their expectations from their coach, they don't stop. Even if they have some injuries, okay, they'll keep playing, okay, and then they'll land up into a big overuse injury, okay, like this tennis elbow, and these are very common injuries that you see. Of course, when you know there is injury, when there is a shula, vata dukte nasti shulam. So there has to be presence of vata. There has to be inflammatory changes also. So you need to identify that phase, okay, and accordingly you have to select Sneha, Gurta. For most of these athletes, okay, I start with Sneha. It's always there. Like for example, many female athletes, no, they come. There is one female athlete tried. Okay, most of the girls, they'll end up into dysmenorrhea. Most of the girls who keep practicing, vigorously, after few years, they will disturb their hormones. They'll come with hypothyroidism or some other. So that this there is a vata prakopa, there is a dhatu kshaya is happening. Okay, you need to stop that samprati getting worse and showing some other pathology. So you always have to consider sneha pana before you start your treatment or along with your treatment. It's always there. It's always on the card. Whether you use like Dhanvantara Ghuta, whether you use Saraswata, it depends upon again Agni. It depends upon which dhatu you find, okay, or which dushti you find. But Snehapana is mandatory. That's for sure.
Sure. Thank you, sir. Again to Srirang sir. Sir, here we always see that when a patient is admitted, sometimes we are going with Anuvasan or Matra Basti and Nasya also. So there are, it happens many times. So if Ubhay Marga Snehapana is Varja, there is Snehapana given Abhyantar also, Matra Basti is also given, Nasya is also given. So how do we just only whether it is the Matra that is doesn't hamper the case, or how do we look towards it? Whether it is Shastra Virodhi or whether we are making practices or it is dependent upon Matra. So your experiences, please.
Giving Abhyantar Snehapan and Matra Basti is Shastra Virodhi. Using different Vicharanas at the time is not Shastra Virodhi. So it can be, the dose of Sneha can be increased in Ahara in different way. Abhyanga can be done along with that. Similarly, Matra Basti can be also used at the same time. So this is like a Vicharanas can be used in a different way. That is not Shastra Viruddha. If you are using multiple type of Sneha infestation in the body, again Rasa Niramata is really needed. So as Sir has said, the use of Takra or some Rukshan or some Pachan must be done in between, so that you can prolong this for the sports also, for Rohan also, for Shaman also, for a longer duration. I am very happy what he told about CKD cases. I am using in same pattern, but I am not using Takra as a Rukshan media. I am using Indrayavadi Vati as a Rukshan factor. I am very happy that I am doing good.
Prasad sir would like to comment upon the same question. Anything that you want to add up to the knowledge of the students?
I think it all depends on the condition. Because see, in Shamana Sneha, there are potentials. See, mixing multiple things safely without causing. See, that Ulklesha Agni Sneha. If Sneha is done indiscriminately, it is going to create unwanted Ulkleshanam and Agninasha. So, just focusing on the best results that you are supposed to get from Snehavasti. If you start doing Snehavasti indiscriminately along with many other procedures, you are killing the patient literally. So there should be some sense, as I mentioned earlier regarding the Dr. Tapan's comment. You need not be always blessed by the Charaka. Because sometimes the curse from the patient may go above all these blessings. So I think Tishthatya very yuktitnaha. So I think the yukti, what you are going to do, what is the intended result and what you are actually getting. This should be always looked for.
Right.
Then you can do whatever you like to. That is what I feel.
Yeah. Thank you, sir. Yeah, sure.
त्याचा प्रश्न परत मला असं वाटतं की एकाच वेळी अनेक उपक्रम करावेत का न करावेत ते शास्त्रशुद्ध आहे का नाही, आणि अशा उपक्रमांनी म्हणजे असे उपक्रम करत असताना आपण शास्त्रविरोधी किंवा अशुद्ध चिकित्सा करतोय का, असं वैद्याला वाटावं का, किंवा वैद्याला ते न कळत होत असतं का, अशा तऱ्हेचा हा प्रश्न आहे. तर बहुहेतू असताना, बहुलक्षणं असताना, बहुआयामी संप्राप्ती असताना, म्हणजेच आत्ताच्या सहज भाषेत मल्टिपल सिस्टीम फेल्युअर किंवा मल्टिपल ऑर्गन फेल्युअर, आणि आयुर्वेदाच्या दृष्टिकोनातून इतके हेतू घडवलेत की कुठल्या हेतूची काय संप्राप्ती घडते याचा पत्ताच लागत नाहीये. असं जर जेव्हा असेल तेव्हा बहुविध चिकित्सा करणं हे जास्त संयुक्तिक नाही का, असा माझा उलटा प्रश्न आहे. जेव्हा तुम्ही खूप मोठं, म्हणजे एक तर 5-50 छोटे अधिकारी द्या, नाही तर एका प्राईम मिनिस्टरला बोलवा. जेव्हा तुम्ही स्नेहपान, अच्छ किंवा सिद्ध स्नेह या स्वरूपात देताय तेव्हा, आणि स्नेहमय पुरुष आहे तेव्हा फक्त स्नेह सगळ्यांना रिप्लेस करेल. आणि तसं नसेल तर एका ओष्ठामध्ये जाणाऱ्या एका प्रधान स्नेहाला पर्याय म्हणून नाकात तेल घाला, कानात तेल घाला, चेहऱ्याला किंवा संपूर्ण शरीराला स्नेहन करा, अनुवासन बस्ती द्या, कटिबस्ती करा, उदरबस्ती करा, अशा सर्व तऱ्हेच्या स्नेहाने अग्नीचं संदूषण चालू ठेवत आपण चिकित्सा करू शकणार नाही का, किंवा तशी करणं संयुक्तिक नाही का. जेव्हा आयपीडीचा पेशंट असतो तेव्हा या प्रकारची गरज भासतेच. आणि जेव्हा ओपीडी, म्हणजे खरं तर नुसता अच्छ स्नेहपानाचा पेशंट हा आयपीडी ठेवायचा नसतो, ही कल्पनाच मुळात चुकीची आहे. कारण आता सरांनी सांगितल्याप्रमाणे त्यांचं सतत अवलोकन करावं लागतं, आणि सतत अवलोकन करून फक्त मात्रा ही त्याच्यावर काम करते असं नव्हे, तर अग्नीला तो बायपास करतोय आणि आता परत अग्नी उत्तिष्ठ झालेला आहे, ही अवस्था नाही येते. आणि आमच्या उत्क्लेशन करणाऱ्या स्नेहाचं शमन स्नेहात रूपांतर होत नाहीये ना, यासाठी मला सतत लक्ष ठेवायला पाहिजे. आणि ती सतत लक्ष न ठेवता आपण छोटे छोटे अधिकारी, छोट्या छोट्या उपाययोजना करून आपण तेच स्नेह हा वेगवेगळ्या उपक्रमांनी आपण वापरून आपण बहुविध योजना करू शकतो, आणि ही आयपीडीची गरज आहे.
थँक्यू सर.
सप्ताहेन बलालाभे क्रियामन्यां प्रयोजये पूर्वस्यां शान्तवेगायां. So that is very important.
That is what for that in Charandar the sequence is given. What should be done first, then second,
Yes,
then
yes,
third,
yes.
and that should be 100% follow while doing Bahuvida Chikitsa.
He wants that. Na kriya sangarohita. So there should not
I
be
say
kriya
that
sangha.
incubation period for that
Should be there.
that
That should be
particular
considered.
karma.
Yes.
So such a wonderful session, and it should never stop. No, it should just go on throughout the day without kshut pipasa of ours. No big. So we have to. Time is an important factor, as we have known. So we have to end somewhere. We have to stop somewhere. Take some interval. So I would like to get some tips from Prasad sir, because I have seen him not from now, but always that whatever he even smiles, it gives a very good sneha. So, and his talk, his look also, everything is Snehamaya. So, how could a Vaidya, with all the hassles and being a principal of one of the colleges, being with different institutes, being a person in an institute who holds it, how could we keep our Sneha as Vaidya? Is it only Sadvritta, or there is something? And to balance this Sneha, if, of course, Vyayama and things other, how could we balance it? And so could he just give an insight for youngsters and for like Manda Buddhis like me also? So to give some, so what are the general do's that he would recommend? Yeah, thank you, sir. Yeah.
My wife is there with me, so so if I lie, I think she won't.
Not allowed to lie.
Yeah. To be very honest, I don't know. See, I learned this Ayurvedic principles and practice, especially philosophy, from my Guruji. partly from parallel to my academics. I was there. See, in '89 I started my BA. So '89 itself I reached my guru's house. Then up to his death, see, on 2010, November 14th, November 21st he passed away. So even that midnight, 20th midnight, I was there with him. So not continuously, but whenever. So and there was a bonding of such a thing that he has 4 sons, but he will not obey any of those 4 boys, but me. So they frequently even call me, Prasad, please come. He's not eating something, anything. Please tell him to eat something. So I used to go there and I feed him when he was 90 years. So all through his life, I am witnessing how a person is shedding his rajas and tamas slowly and evolving into a Suddha Sattva. From 69 years to 90 years. His 20, that is the 21 years. So he was insisting that many things, be simple, humble and modest. Don't take anything for granted. And nimitta matram bhava savisajin. Nimitta matram bhava savisajin is from Bhagavad Gita. Arjuna was advised, Krishna advises him. Arjuna was just trying to escape with lot of philosophical logics. Then at one point Krishna was telling him, my boy, I have already killed all of them. You just go there and play the drama and take the fame. It is not you who are going to kill all these guys. Nimitta matram bhava savisaji. So in the same way, while we are doing these things, we are just becoming the nimitta matram. Don't say that we are doing all these things. Of course, I am also going through many stresses, many pressures, especially the manpower management. In a very tough situation, I took over as the principal of an Ayurveda college. Then this institute with the nearly 26 staff. All these things are, but I think asangoham puna. That is the only way out. Nothing more, nothing less. Thank you.
Here we conclude with this session, and I hand over the mic to Vaidya Nilesh sir for the further proceedings.
Thank you, sir. The panel discussion is over, but I request the president or chairperson of the panel discussion, Vaidya Trilok Dhopeshwarkar sir, to give the concluding remarks.
I think I have overruled the rules of Sabha many times, speaking in between. अध्यक्ष असताना मध्ये मध्ये बोलू नये, सगळ्यात शेवटी बोलावं असा एक संकेत आहे. Yet to conclude, just like you, I am also a student, and I have taken some points which may be helpful to you as a take-home values. So I'll repeat them, and that will be a concluding session, actually concluding speech as such. The first, whenever he was speaking, I was not thinking that somebody else is speaking. He is speaking my thoughts only. So another body with the same thoughts. And when we spoke with each other, that I find that what he said, that when you have a rule and you say point out 20, so the only one possibility remains, n number of possibilities remains, that somebody will point out another than 20. But the 1.1 is that when we ask to mark 20, we will mark 20, and another possibility is we mark anything else than 20. When it is a satya, it will come out of everybody's mouth as it is, and when it is asatya, it will have n number of manifestations. So whatever we want to have, that satya and The another point is have a shashwata satya for our practices. Besides my students, I would like to ask one question. What is more important? Just it is a वैश्विक क्वेश्चन ना. What is more important? सबसे ज्यादा प्रिय क्या रहता है? ये इसकी हिंट है ना. सबसे ज्यादा प्रिय क्या रहता है? प्राण. सबसे ज्यादा दुनिया में कहीं भी जाओ, यू आस्क सबसे ज्यादा क्या प्रिय है? प्राण. तो सबसे ज्यादा महत्वपूर्ण क्या है? ऐसा एक क्वेश्चन है. कैन एनीबडी आंसर? कोणी उत्तर देऊ शकेल? आत्ता जे आपला सेशन झाला या सेशनशीच संबंधित आहे, पण ते वैश्विक सत्य आहे. what is most important? मी, आम्ही, ईश्वर, काळ, देश, पाणी, हवा. नियंत्रण. त्याचं उत्तर आहे नियंत्रण, कंट्रोल. द लास्ट वर्ड मिस्टर प्रसाद uttered, not more not less, means exact, means control, means whatever sneha you are going to give should have a vaidya should have a control on that. And still saying so, what he said in between, I actually, it was a cake for me, that it depends upon the patient's word. It depends upon the patient's word, though it is a subjective element, and it depends upon the word. It means that रुग्णाच्या कथनाला आयुर्वेदाच्या चिकित्सेत अत्यंत महत्व आहे. I know one, आता मध्येच एक थोडंसं बाजूला जातो. I have never ever thought that this situation may come, that I have in Pune, in Maharashtra, I have to speak in English, because I have never ever thought that some speaker, non-Maharashtrian speaker will come. I am always fond of speaking Marathi itself. I am very comfortable in Marathi. आज ही नवीनच सिच्युएशन आलेली आहे. ह्या सिच्युएशनचा विचार केला नव्हता मी. स्ट्रॅटेजिक अटॅक येतो. Once upon a time my sir was speaking and he said that this patient is having a rudrava. And what we said, nowadays rudrava is said as something similar to palpitation. पाल्पिटेशन, जिथं जिथं आत्ता कॉलेजला जाल तिथं पाल्पिटेशन आहे म्हटल्यावर रुद्रव लिहिलं जाण्याची शक्यता जास्त असते. वेरच सरांनी जो पेशंट दाखवला होता, what the patient said that I have a feeling like some water is dropping from my heart. Tipic. That is rudrava. So we have to learn, we have to actually listen to the patient, and he always tells us about the ansha kalpana of samprapti. He guides us that we have to listen to him. And nowadays the major difference in between the allopathic practice and Ayurvedic practice is that nobody has got time to listen to a patient. Very recent, just in 2 minutes they have their diagnosis, and rest of the papers they depend upon that. Whereas to any fastest Ayurvedic physician, fastest successful Ayurvedic physician you go, he needs some more time. He cannot have an hundreds OPD. If he does, he has got a different aspect for that. But for his general OPD, a neurologist see a patient within 4 to 5 minutes in his normal OPD. Whereas just to know that patient's problem, we have to give half an hour. That is the thing. Okay. So it depends upon the patient's word. Though it may be a Snehapan or it may be general practice. Then regarding what the words he said, that attacking the Agni, not permitting Agni, and Sneha enters into the system without security system. There was a very typical word used. इसके पीछे याच्या मागे संकल्प काय आहे, whether we are using it as a therapeutic way or he hasn't mentioned, or it is a wish. There are two incidences where we invalid the security system. One is Prime Minister, another is Atireki. कौन सिक्योरिटी सिस्टम को लांग के जाता है, किसको सिक्योरिटी सिस्टम की जरूरत नहीं रहती? वन इज प्राइम मिनिस्टर, वन इज द मोस्ट लॉयल पर्सन टू द नेशन, एंड अनदर इज मोस्ट इलॉयल नॉन लॉयल पर्सन टू द सिस्टम. एक विष है, दूसरा घृत है, स्नेह है. तो एक स्नेह है, जब हमें if we want to give it therapeutically, then it becomes a prime minister. Okay. When the calculation fails, then the Vyapad may happen. That is what he said. Okay. And at the end he said, I haven't gone much more Vyapad. So we have to go, sit, assist, be with him to learn the calculations. Okay? And that is the way that one has to learn. As he learned with his guru, you have to be a student and you have to be associated with him. No more questions, no more shanka, no more sangshay, nothing. Just keep watching and learn whatever you want. Ultimately, every question will be answered with the association. Okay. Then the word was doshe swapathe. So everybody knows that mala, mutra, udgara, laghava, all these things they happen because of this. Then Srirang sir had something, that two examples he gave. एक आहे डिमॉनिटायझेशनचं आणि दुसरं आहे बांगलादेशांना शोधायचं. सो याचा अर्थ काय की देर इज अ करन्सी, वन इज फेक करन्सी, अनदर इज रियल करन्सी, अँड टू जस्ट पॉइंट आउट द फेक करन्सी you have to go for demonetization. So for taking out the doshas out of the body by shodhana, you have to do something which will be similar to that demonetization. Then Mahesh sir, whatever the information he gave was important, but the word he used is apatsu mitram. आपत्कालात जो आपल्याला मदत करतो तो मित्र. Now we have a practice that whenever I go or whenever my student they open a clinic, I always present them only sneha and kalpa. That is, either it should be Shatavari Gruta, Shatavari Taila, Muruenna Taila, Dhanvantar Taila, all Sri Gopal Taila, and Shatavari Kalpa, Ananta Kalpa, those who want to open their clinic and to have this. Yes, please invite me. Then another important word he said, that Shirogata Sneha. What is Mastishka? Mastishka is Shirogata Sneha. Then which dhatu represent the Sneha in the body? Rasa, Rakta, Mausa, Meda, Asti, Majja, Shukra. Meda. So it means that he mean to say med is Mastishka. Yes, na? So med is Mastishka. Now eliminate that thing, that Majja is Mastishka. Neurology is Mastishka? No. Med is Mastishka. Because Shirogata Sneha is Mastishka. टेक होम व्हॅल्यू काय आहे का? विचार करायला करण्यापुरतं तरी आहे का? सुश्रुत रेफरन्स काढा, सुश्रुतात मिळेल. म्हणजे काय रेफरन्स काढणार? श्रीरंग सरांनी वेगवेगळे कल्प सांगितले. त्याच्यामध्ये यवकोल कुलत्थ याच्याविषयी सांगितलं. अनुवासनामध्ये यष्टीघृत तैल आणि विडंगादीबद्दल सांगितलं. अरजस्का या अवस्थेमध्ये खूप वेळा अनुवासन दिल्याने मग त्याच्यात आपोआपच पुत्र का अपत्यकांक्षी हे फल मिळू शकतं. एक मध्ये प्रसाद सरांनी उल्लेख केला तो महा या शब्दाबद्दल. महातिक्तकघृत, महाकल्याणकघृत. तर त्याच्यात महा हे रसायन किंवा महा हे प्रिफिक्स असताना रसायन हे कार्यकर्ता असं आहे. अर्थात ही एक विशिष्ट प्रकारची ट्रॅडिशन आहे. असं ग्रंथात असा उल्लेख आलेला नाही की महा असेल तर रसायनच असतं. आपल्याकडे महातिक्तकघृत आपण रेग्युलर वापरतो. त्यामुळे आपल्याकडे ही ट्रॅडिशन ह्या अशा तऱ्हेने वापरण्याची किंवा अशा दृष्टिकोनाची नाही आहे. असं एक आहे. महेश सरांनी आणखी एक सांगितलं की when the training system is not followed, then there are injuries in the sports medicine. When the training system is not followed, then the injuries may happen. बरोबर आहे ना? When the training system is not followed. Who declares the training system? आम्ही तर नाही बाबा, आमच्याकडे कुठं आयुर्वेदाकडे आलेच नाही ट्रेनिंगचे तसं घ्यायला. कुठे आलेत आणि तुम्ही कुठे गेलात? टू जॉट डाऊन द ट्रेनिंग सिस्टीम. हॅव एनी वैद्य हॅज gone, has seen, has been has been administrator to the training system. Are we training? No. There long back ago there was system that Vaidya was deciding as a training system. And now today's physiotherapist, they decide the training system which depends upon some another system. Now what to do? So there are many patients. So many of them, they undergo injuries. Yet there are many more successful players and successful trained persons. And because of what they could be successful? So there is one chance that that system is also valid and doing well, but there are some lacunae in that, and we have to jot down our own system which is right now extinguished. We have to go for that. Okay. Now this is actually a big question, but why we need help of allopaths or allopathy? Something. The question, it was in between that Prasad sir is giving Grutapana, then again Takrapana, then again Grutapana, and as a Vrukka is made up of Meda, so that Sneha works, and which is a Siddha Sneha. Still in between, to safeguard the Agni, we have to give the Rukshan. And then मध्ये आपल्याला क्रिएटिनाइन तपासावं लागतं किंवा मध्ये आपल्याला दुसऱ्या कशाचे तरी मदत लागते. ही मदत का लागते? Why we need such kind of help? Because the today's circumstances, not a single patient comes, or actually not a single, this is a wrong word, but many patients, those who are in difficulty, they come through, or they come as a second opinion to us, not as a first opinion. Those who are our family patients, they directly come to us. We have, and what in today's condition, how a successful Vaidya should be said as a successful when he has a direct patient, not going to any other pathy, directly coming to you, whether it is a fracture, whether it is a Vyapad, whether it is a snake bite, or whatever it may be. If he is, whether it is a Jwara, whether it is a so-called COVID, he comes to us, say to us that we have got a fever. So is it that we could be possessing, or we could be having a COVID? So we say that no, it is Jwara. So it is most likely it is COVID, but not to worry, because though you are labeled as a COVID, we are going to treat you. So that there is nothing that whether you want that you should be said in the society that my COVID is gone by the Vaidya treatment, then you go and test. Otherwise, there is no need of saying so. So have a Jwara, we treat them with the Jwara Chikitsa, and it's over. So there is no need of that. But it happens only to those Vaidya where the family patients or family as patients are coming as a family to family. Otherwise, for a new patient, we come as a second option, and then he has taken all other treatments, and there lot many parameters he has seen, and he comes to us, सर हमारा कैल्शियम बढ़ा के दे दो, हमारा B12 बढ़ा के दे दो, हमारा क्रिएटिनिन कम करके दे दो, ABCD. So that is there this answer lies. Then last point, that we must have a sankalpa. Then only that medicine works in a nicer manner. उसके पीछे हमेशा तर्क शुद्धता होनी ही चाहिए. There must be a logical end to every situation. But still, if you have a sankalpa, then many a times the beauty of Ayurvedic medicines is they have got their own personality, and they will work for your betterment because they are meant for your betterment. It is written over there, it was written Alakshmi Nashanam, Lakshmi Kali Nashanam. So Alakshmi Nashanam, Kali Nashanam. तो उसके लिए मला एकदम आवडतं उदाहरण आहे की फेअर अँड लवली लावलं की आम्हाला पायलट नवरा मिळतो किंवा आम्ही एअर होस्टेस होतो. फेअर अँड लवली लावलं, पण माझ्याकडे एअर होस्टेस होण्याची क्षमता असताना मी फेअर अँड लवली लावलं, तर मी 10 उरलेल्या लोकांमध्ये फेअर अँड लवली लावल्यामुळे पण आधीची क्षमता असल्यामुळे मी एअर होस्टेस होऊ शकतो. आता इथे कसं आहे, बरोबर विरुद्ध अलक्ष्मी नाशनम. कधी अलक्ष्मीने सुकुमार घृताने, when you have a सुकुमारक घृत, you have a malashuddhi. When malashuddhi happens, buddhi pravartana happens. When buddhi pravartana happens, ichha happens. When ichha happens, prayatna happens. When you do prayatna, you have a Lakshmi. It is not that you go on eating a sukumara ghrutan, sitting just like that, and दे असेल हरी तर देईल खाटल्यावर, मी इथंच बसून राहणार, मी काय करणार नाही. It is not going to happen. Actually, it won't happen because it won't, that Sukumaraka Ghrutta won't allow you to do that. That is the beauty. That is the beauty. It just, when you pass your mala, when your body will clean, it won't allow you to sit. It will just force you to act. And when you act, Lakshmi is going to come. Not, I don't know in the which form. It will come in the form of woman with lot much dowry, but it will happen. That is the beauty. Okay, so I don't know whether I have played a role of Adhyaksha or not as a president, but to have a chat with all the students and those who are very enthusiastic, it gives me much more happiness. And to be on ground itself and to be amongst you and to be with you, that Nilesh gave me this opportunity, and I'm very thankful to him. And rest of the all speakers, I'm not that elder and bigger and mahatvapurna, not important, that who will comment on their words and their sayings and their thoughts. But definitely, whatever I could see on your faces, that all of them, they have gave you lot much knowledge, enthusiasm, and to have a great successful Ayurvedic practitioner, they have given enthusiasm for that. And I thank on behalf of Nilesh sir to them, all of them, and I thank all of you for the patience listening.